Hi, everyone. Thanks for joining us today. We are going to talk about, when is a cough more than just a cough? We are officially in the cold season, and I'm sure many of us are starting to get a cough here and there, but it's important to know, when is the cough serious? When should we go see a provider? So, we're going to talk about red flags that can indicate lung disease. And joining us today is Dr. Inderpal Thethi. He's one of our pulmonary and critical care medicines. He's an amazing provider. I'm so excited to have him here today. He practices in our Mount Carmel Pulmonary and Sleep Taylor Station. So if you want to book an appointment with him or just learn more, please be sure to head over to mountcarmelhealth.com. Here you'll see a little bit of his background. He attended St. Matthew's University School of Medicine. From there, he completed his residency in the University of Arkansas and Jersey Shore University Medical Center. Now he has a lot of board certifications. He's board certified in critical care medicine, pulmonary disease, neurocritical care, family medicine, and internal medicine. So he really is an awesome provider to have with us here today. Dr. Thethi, thank you so much for joining us. The floor is yours.
Thank you very much, Diana, for a wonderful introduction, and good evening, everybody. Thank you for being here. Let's get started. So why is this important? I guess understanding why a chronic cough happens deserves a lot of attention. Recognizing early red flags of lung disease is very important for your overall health, and learning when to seek medical help. When should I be seen for my cough? Is this important? Is it not? We'll definitely get into that. Next slide. So what is a cough, and understanding exactly what makes us cough? So what is it and why does it happen? So cough is a forceful reflex that helps to clear germs and dust from your lungs. It's your body's way of protecting itself from things that clearly should not be in your lungs or your throat. When a cough doesn't stop, that could mean that something is wrong. Typically a cough shouldn't last that long, but definitely something could be going on. So there are a lot of common causes that are harmless, and these harmless causes could include a cold, a flu, seasonal allergies, especially in Ohio, mild throat irritation, but these usually go away within a few weeks. Next slide. So why does this information matter? Like I said before, most coughs are harmless, but sometimes they're not. Sometimes it's your body's alarm system of saying, hey, I need to go be seen by a doctor. Knowing what signs to look out for can definitely save your life. Next slide. So what could it be when a cough lasts too long? Common things that are causing persistent cough are a postnasal drip. I have a runny, drippy nose. Acid reflux, where it's burning in your throat and in your chest. Asthma or a COPD. Smoking, definitely smoking. And even side effects of certain medications can cause a persistent cough. If your cough sticks around for more than 8 weeks, it's time to get checked out. Something is not right. So the next slides are going to be dedicated to common misconceptions about a cough. So myth number 1, it's just a cough, it'll go away. The fact of the matter is that most short coughs are harmless, that is very true. But if it lasts more than 8 weeks, it's definitely time to see a pulmonologist or even your general doctor. Myth number 2, coughing up blood is normal if I have a sore throat. The fact is, even a few drops of blood is abnormal. And if you're experiencing this, you definitely need to be seen right away. Coughing up blood is never normal. Myth number 3, dry coughs are harmless. The fact is, a dry cough can come from asthma, from acid reflux, and a variety of different lung problems. So yes, dry coughs can be harmless, but nonetheless, they still need the proper investigation and workup. Next slide. Myth number 4, smokers always cough. It's nothing. A smoker's cough can hide some serious problems. And some of these serious problems can include lung cancer and lung scarring and a whole host of different lung problems. So a smoker's cough, although it's common, a lot of times it's not normal and it definitely needs to be checked out. Myth number 5. Hey doc, my chest x-ray was normal, so therefore I'm fine, right? Absolutely not. Sometimes it takes it takes a while for problems to show up. So even though you have a normal chest x-ray, which is good, you can still have a brewing or developing problem in your lung. So definitely stay in tune with your symptoms and get checked out. Next slide. Myth number 6, coughing has to mean that it's a pneumonia. The fact is that's not always true. If you have a cough, fever, or chest pain, please seek medical attention. It could mean a whole host of different things, but it needs the proper workup. One of my favorites, myth number 7, cough syrup will fix it all, doc. And that's simply not true. Cough syrup will help your comfort and relieve some of your symptoms. It doesn't treat the underlying cause of a cough, it'll help suppress it. So while it helps your overall symptoms, it doesn't treat the root cause. And it's important to find out why you're coughing. Next slide. So kids cough all the time. That's normal, right? They have runny, snotty noses. It's just normal for a child to cough. No, it's not normal for a child to be coughing all the time. A constant or a sleep-breaking cough needs to be investigated. It could be a lot of different things and definitely needs to be seen by a doctor. So please get your child checked out. Myth number 8, if I don't smoke, I can't get lung disease. And that's simply not true. Smoke, pollution, genetics, and dust can all accumulate together and cause harm in somebody's lungs. So even though you've never been a smoker or a vapor, that can definitely cause issues. Myth number 9, which I definitely hear all the time. Hey doc, I'm too young to have lung problems or lung disease. And that is absolutely not true. Having lung problems is not a disease of the elderly, it's a disease of everybody. And conditions like asthma and lung scarring can affect all ages. So what are some of the red flags that would prompt you to seek medical attention? And we'll go through these. So some of the red flags that you should definitely not ignore is coughing up blood, shortness of breath, or wheezing, chest pain, especially that happens with a cough, unexplained weight loss, huge red flag, night sweats, constant fatigue or feeling tired, changes in your voice, and swollen fingertips. If you have any of these, please seek medical attention. These are not normal and can mean serious illness. So please get help. If you smoke and your cough changes, if your cough changes in your sound, or the frequency of your cough changes, or you start to bring up blood, please see your doctor right away. So what can you do as a patient to help yourself? So talk to your doctor, and it's definitely time to see your doctor if your coughing lasts more than 2 months, if you're coughing up blood, which is very serious, if you're experiencing any chest pain, if you have shortness of breath, or if you develop a fever or sudden weight loss. Please, these are very important and they should not be ignored, and it needs to be evaluated in a timely manner. So what can you do? Number 1, stop smoking, stop vaping, stop putting any sort of smoke inhalation in your lungs. Stay current on your vaccines. Vaccines save lives, and that's the truth. Avoid secondhand smoke exposure. Keep your air clean, get your air ducts clean, change your AC filters, and develop healthy habits, which includes exercising regularly. So simply listen to your lungs. Your lungs are talking, pay attention to them. There's a lot of pulmonologists like myself at Mount Carmel Pulmonary Group. We'd be happy to visit with you and go over any of your concerns. but please seek help, seek a medical professional, and we'd love to go over any of your problems. Here's a QR code that you can scan and get an appointment with any one of us.
Great. Thank you, Dr. Tatey. And that was
Oh, you're
incredibly
welcome.
informative, especially the red flags. It's things that you don't really kind of think about until they happen. So it's good to know that that's something you should look out for. So what we'll do
Yeah.
now is we'll go ahead and open the floor to questions. So for everyone tuning in the Q&A section, feel free to drop in your question on there, and then Dr. Tatey will answer as many as he can. We did receive some during registration, so I'll go ahead and just read those off to you, Dr. Tatey. The
Okay.
first question being, I have consistent cough. Doctor said it's because I'm taking Losartran. Sorry if I'm mispronouncing that. Could it be something else?
Yeah, that's a great question, by the way. Medicines can definitely cause a cough, particularly a dry, non-productive cough. Um, you should definitely ask your doctor and get an opinion as to whether or not it could be your medications. 100%, it could be the medication that you're on. A lot of blood pressure medications, including anything that ends with a pril, lisinopril, Zestril, all these medications can cause a cough. But yes, medicines are a huge risk factor for a chronic cough. Good question.
The next question we received is, what about when the cough is not frequent, but it shows up randomly and lasts 2 to 3 minutes? Should I worry?
Um, it's hard to say. The etiology of that cough could be so many different things. You could have issues with your voice box. It could be acid reflux that's made worse by laughing and emotional stuff. And so certainly needs to be checked out. I think if you're concerned about it, then that's concerning. So definitely it always deserves an evaluation.
Can CPAP therapy cause cough during the day?
Yeah, another great question. Absolutely. So CPAP or any sort of positive pressure that's blowing air in your face and in your sinuses can really dry out your sinuses and your throat, creating a lot of throat irritation. So absolutely, I think CPAP is a large cause of chronic cough. It can be productive and non-productive. Changing out your water in the CPAP is very important. But yes, I think if your cough is ongoing, speak to your medical professional about whether or not it could be your CPAP and what can be done to help it.
Can lung concerns show up as pain or aches on your back?
Yeah, boy, we're just continuing with good questions here. Um, yes, absolutely. Lung problems can present as joint pains, aches, rashes, changes in your nails, but particularly back pain and muscle spasms and aches. Yes, that can mean a sign of some serious illness. A lot of cancers and a lot of inflammatory diseases that can affect your connective tissue disease in your lung and elsewhere can cause pains and aches all over your body. So the answer is yes, that deserves medical evaluation for sure.
That's a good question. The next question we have is, how can I keep my lungs healthy if I have asthma?
Yeah, good question. So definitely be compliant with your medications, whatever your doctor has prescribed. Be compliant, take your meds as prescribed. Avoid any type of smoke inhalation, whether it's secondhand smoke, direct smoke inhalation. Just be careful of your known triggers. If you are allergic to grasses, trees, dogs, and cats, whatever your known triggers are, try to avoid those and any other known allergens. But honestly, stay vaccinated, exercise, and stay away from a lot of smoke inhalation.
And then, how can you tell if a cough turned into walking pneumonia?
Yeah, good question. So walking pneumonia, you're gonna feel different than usual. You're gonna have the shortness of breath, the cough, the aches. You're just overall unwell. If you have a cough that you feel like is not getting better, and now you have other symptoms like a fever or an ache or a rash, definitely see a medical professional and get a chest x-ray to see if this could be walking pneumonia.
And I see someone dropped in a question in the Q&A.
Okay.
Are lungs something to have checked out outside of your annual or general doctor appointment?
So during your routine physical exam, your doctor should and usually listens to your lungs. If there's any sort of abnormal lung sound, or if there's any concern, they would probably investigate that further. Getting breathing tests and other advanced imaging is typically not part of a routine medical exam. But if there's any family history of any lung issues, or if you have a high risk occupation where you're exposed to a lot of dust and chemicals, definitely bring that up during your examination, and that might warrant additional examinations outside of your routine physical.
Let me ask you this. Is there a certain age where screening for lung cancer is recommended?
Yeah, so lung cancer screening typically starts at the age of 50 and it goes up all the way till 80. I think if you have a family history of lung cancer, such as your mother or father or your siblings, again, address that with your medical professional, and that might warrant imaging a lot sooner than that. But typically, we start our lung cancer screening protocol around the age of 50.
Another question that we received is having a lot of phlegm in my throat when I wake up typical for a person age 85?
Yeah, so I think having phlegm in your throat is never sort of normal. I think having this throat mucus, it affects a lot of us, and it always deserves an evaluation. It could be as simple as acid reflux. It could be where you have some postnasal drip going into the back of your throat. But no, having mucus in your throat be as a normal thing as you age, that is not a normal thing, and that still deserves to be evaluated.
Hmm. And then someone is asking about COPD treatments. Are there any new medicines or treatments for it?
Yeah, the world of COPD is changing, I feel like year by year. There's a lot of new medications out there now for COPD and asthma. I would say touch base with your general physician, or if you need expertise evaluation by a pulmonologist, definitely get that going. But the world of COPD has changed drastically, and we have things such as newer inhalers, COPD shots that you give yourself in the stomach. We have valves that you can put, or a pulmonologist can put in your lungs to help you breathe better. There's just so many different options nowadays. But yes, to answer that question, there's a lot of new medications out there and treatment options. So please speak with your pulmonologist at Mount Carmel.
Great. And then one of the last questions I'm seeing here is I'm 61. Both my parents were heavy smokers. I am not, but I lived with them for 22 years and was around them later periodically. Should I go see a pulmonologist?
Yeah, that's a great question. Secondhand smoke exposure is extremely significant. And I think if you were around a household that had a lot of smoke in it, yes, you deserve an evaluation, particularly something called a pulmonary function test, where we look at your lung function and see if you have the early onset of COPD or truly have it. But yes, being around significant secondhand smoke exposure can put you at risk for COPD. So that definitely deserves an evaluation.
Um,
Good question.
well, it looks like that's the last question that I'm seeing. Dr. Tatey, is there anything that you really want our audience to take away or just, kind of learn from this in terms of keeping your lungs healthy?
Yeah, I think the big message is, if you have a persistent cough, um, especially lasting more than 8 weeks, definitely get that evaluated. That is never normal. And point blank, if this cough is affecting your quality of life or affecting you in a certain way, it's important and it needs to be evaluated. And so please just listen to your lungs. Don't play it off as being normal. Things that you can do for yourself, including include living a healthy lifestyle, trying to avoid smoke, secondhand smoke exposure, whether it's direct, secondhand vaping, and getting vaccinated. Staying healthy during this upcoming season is going to be very important for people with chronic lung problems. But just listen to your body, listen to your lungs, and get checked out. Like I said, we have a lot of pulmonologists at Mount Carmel, and we're all happy to help in any way we can.
That's good to hear. I'll go ahead and put in the QR code here for a couple more seconds if anyone wants to scan it with their phone. Dr. Thethi, thank you so much for being with us today and sharing your knowledge. If anyone joined a little later, or if you know someone that missed the webinar, you will receive an email with a direct link to all of our webinars, but you can always go to mountcarmelhealth.com/webinars to view them. All right, well, thanks everyone for
Thank
spending
you
some
very
time with
much.
us today. I hope you all have a great evening.
Thank you, guys. Have a great
Bye-bye.
evening.